everybody. Tonight's workshop is on arthritis, and tonight Shira's going to help us give the workshop. I'm sure most of you know Shira if you haven't met her. Shira's been a patient here since she was about your size. Stand up so everybody can see. Yep.
And when I was your size, I came to every single workshop for like 2 years straight.
Yeah, so she's very qualified to give them, but I'm going to sit right next to her just in case she needs me. So I'm sure you guys are all tired of listening to me all the time, so now Shira's going to take a turn at it.
Let's see how I do. You're going to clap anyway, right? You can practice now if you want. Yes, okay. So our workshop tonight is about arthritis, colloquially known. Everybody hears arthritis and just says, oh, my knuckles hurt, I have arthritis, you know. So what is arthritis? So degenerative arthritis is a progressive, non-inflammatory disease characterized by degenerative changes in cartilage and its related components, and is the most common of the 3 types of arthritis. Basically, it's what people experience is the pain and the inflammation of the joints.
Yeah, there are...
You know, please.
Yeah, there are different kinds of arthritis. But the one that's most common is called degenerative arthritis. That's basically wear and tear, right? So that's the one we're going to focus on because it's definitely the most common of all the arthritides. There's like psoriatic, rheumatoid, those have changes in the blood. But degenerative arthritis is like the reason that you get the tires on your car aligned, because if you don't, they wear down. That's what degenerative arthritis is in the body. If it's not aligned, it wears down.
Okay. So when you go to Americans above the age of 65, almost 100% of people have arthritis. That's a huge number. And
that's pretty much all of them.
Right.
Yeah.
Right. Pretty much everybody, you know? 80% of people over 50 have osteoarthritis, which is what we were talking about.
Yeah, it's the same thing. So once you're above 50, chances are you're going to have it. Once you're above 65, you're going to have it if you haven't cared for your joints. So that's what this workshop is about, teaching you exactly what it is and how to prevent it.
Right. So we spoke about age, you know, 50 and 65. So does it come because of age? Is it, oh, when I get older, I won't get arthritis because, you know, that's what happens when you turn 50 or 65.
Let me ask you a question.
Yeah.
When you go to the doctor and you have hip pain and the doctor says you've got arthritis in that hip, is that because of age? We have a yes. Anybody else? No? You're not sure? No. Okay, so let me ask you a question. If you go to the doctor with left hip pain and he says you have arthritis in that hip, if it's because of age, isn't that hip the same age as the other hip? Mm-hmm. Aren't both your hips the same age? So why would you only have it in one hip? Right?
The other one's younger than the other one.
Yeah, exactly. This one came out first when you were born. So it's not a factor of age. It has nothing to do with age. Because again, you can have it in one knee. The other knee's the same age. You can have it in one elbow. The other elbow's the same age. The shoulder, same thing. So is it a factor of age? No. No. Yay. Good job, guys. So what is it?
Yeah. No, so something that I learned right away is if you properly care for your spine, how long is it going to last? Does anybody here know how long should your spine last before it starts to degenerate if you take care of it? This is one of the first things I learned. You didn't teach it to them.
They know. They know. Go ahead, Sadia.
72?
Keep going.
90?
Keep going.
Really?
Yeah.
Was it 192?
125 years before you see any signs of wear and tear if you properly maintain your spine.
Which means arthritis could be normal when you're 125. That makes sense to get arthritis.
Exactly. But is anybody here 125? Has anybody here been told they have arthritis?
Do we even live to be 125?
Well, that's exactly the point. We don't, because we haven't taken care or learned to take care of our bodies properly from birth. And you see, a long time ago, we weren't living as long as we are even now. So the things that we get now at older ages, we never got before. And people would say, well, you know, we don't live that long. What's the difference? But as we learn to maintain our bodies naturally and we live longer, these things become a factor.
Okay, so what causes it? Now think very hard. You're sitting in Dr. Suzi's office and she's giving, and we're giving a
Yeah.
workshop. What causes arthritis? What would the number one cause be if you had to think?
What is it that we treat here? What is it that we're looking for? What's that big word that starts with an S?
Yes,
Subluxation. Exactly. So by definition, what is subluxation? What's the first part of it?
This is what I always do. This is the first thing I hear, subluxation, and all of a sudden my hands are going like this, and then they're stopping.
Yeah. What's the first part of subluxation? The bones are what?
Cracky.
Misaligned, right? The bones are out of alignment. Now, why is that a problem? Because the bones have a certain shape. They're made with a certain shape. And if they maintain the alignment, that shape works. But if the alignment's off and gravity, which is a crushing force, is acting down 24/7 all the time, the bones aren't meant to handle that kind of stress when they're out of alignment. So they wear down. And what does that mean? You are constantly building up and breaking down bone in your body all the time. Did you know that? Bone is being built up and broken down. When it's not built up quickly enough, we have something called osteoporosis. The bones thin out. But that building up process happens along stress lines. So if your spine is out of alignment, or any joint in the body is out of alignment, and gravity's acting down on it, you're using your joints, weight-bearing joints, meaning knees, ankles, hips, those are the first ones to get arthritis. Yeah, you know that, right? Because there's even more stress on those joints. So they're going to build up or lay down more bone quicker, and that's those bony deposits that your medical doctor will call arthritis. It's simply because it's out of alignment. Does that make sense?
Yes.
Keep going. So joint misalignment, subluxation, loss of motion in a joint, and that's probably the biggest thing. If a joint can't move, you're gonna lay down more bone. If it's stuck, you're gonna lay down more bone, and eventually what's gonna happen? The bones will actually what? Fuse. The bones are gonna fuse together. That's arthritis. When the bones fuse together. What happens when the bones fuse together? What can we do for that? This is like the most silent crowd. Well, if the bones are fused together, that would be like giving an adjustment to the arm bone. Like, can you do anything to a bone that's fused together? Absolutely not. It's stuck. You're not going to do anything once it's stuck. So arthritis taken to the extreme is fusion. It's not reversible. It's permanent. It's stuck there. Okay? And in the spine, when that happens, it puts pressure on the nerves. Now you're cutting off signals to the body. So your body can never be healthy again because at least one organ is starting to wear out. At least one organ. But we know the body works together, so if one organ's affected, another organ's going to be affected, and it's a cascade of events. And this can all happen from lack of motion, arthritis, deterioration, or subluxation.
So now everybody here knows what arthritis is, and even though no one is above the age where they have it, what could you guess the symptoms would be? What are symptoms? What do you feel when you have arthritis? Do you know?
Pain.
Pain. Top one. Anything else?
Numbness.
You can have numbness for sure. What do you see in fingers when they're arthritic?
We cannot move the finger.
Right.
They get crooked, so you have deformity of joints. They can't move as well. They're tight. They're restricted.
What about size in the joints? Do you see ever get bigger? Yeah.
And what do we call that when there's swelling in a joint?
Inflammation.
Thank you. Inflammation. Okay. So yeah.
And we said reduced ranges of motion. You can't move as well. Yeah.
Exactly. So what are the things that would cause a joint to be out of alignment? Whether, again, it's the knee, the elbow, the spine. What causes that? Where does that come from? Why does a joint get out of alignment to begin with?
It could be many things. Posture, accidents,
Posture, accidents, those are the biggies. When does it start? When's the first time we can possibly get joints out of alignment? During the birth process. That's the most traumatic experience of our lives. Right during the birth process, as a doctor takes a baby's head and twists and pulls, or a C-section is even more traumatic. Right then and there, we can start with subluxations, or these joints being misaligned. As we're starting to walk and we're falling all over the place, we definitely have impacts to the spine. Do you think that could cause subluxations?
Yes.
Absolutely. Good job, guys in the front row. What else? How about stress? Does anybody ever notice when you're stressed, your muscles tighten up? When those muscles are tight, where do those muscles connect to? Your neck, your spine, your joints. So if you have just one muscle that's going to a joint that's tight, is that muscle going to pull that joint out of alignment? Yeah. See your knee. Say it looks like this, right? And it's gliding and it's doing its thing. But say this one muscle coming down on the side is tight. So it pulls it just a little bit this way. Now it's grinding instead of gliding, and that's going to cause it to wear down. A tight muscle, that's it, because that's where the muscle's attached. So one little tight muscle can pull a whole joint out of alignment. Has anybody ever told you stretching is important? Why do you think? Go ahead. It keeps your body strong and flexible, and it protects the joints. And if all of the muscles are stretched out, the joint's going to work smoothly. The joint's going to glide. If one muscle's tight, it's going to grind. Okay?
We ask this a lot in terms of medicine, is what are we trying to treat? Are we trying to treat the symptoms, or are we trying to treat the cause? Anybody? What are we trying to treat? Cause.
Yeah. And what does the medical profession do? Do they treat the symptoms or the cause? When you go to your medical doctor, what can they offer you? They're treating the symptoms. They're trying, you're going to them and you're saying, I'm in pain, do something. And they do. What can they give you?
Painkiller.
Painkillers, medicines. They can give you NSAIDs, which are non-steroidal anti-inflammatory drugs. But unfortunately, a lot of those things will confuse the body and cause the symptoms to accelerate. Okay, so if they give you a non-steroidal anti-inflammatory drug, like a cortisone injection or something like that, first of all, those drugs have ingredients in them which will actually cause more breakdown. So that's one problem. But the other problem is, say you're a runner and you have a problem in your knee and you get a shot to take away the pain, but you still have those tight muscles coming in and the joints are still out of alignment, but you're like, well, I don't feel pain, I'm going to keep running. Is that helping you or making it worse quicker? That was great, guys. I love that. Absolutely. So it's you want to know when you're treating something, what's my goal? Do I want to just suppress the symptoms, or do I want to treat the cause? Now, so many people will say, I just have to start exercising and I'll feel better. But if you're exercising on a spine or a joint that's misaligned, you're increasing the load. You're causing it to wear down more quickly. If you do physical therapy on a joint or a spine that's misaligned, you're increasing the load. These are things that you want to do after the alignment's better. Once it's lined up, that's when you can start strengthening, but not until it's lined up, because you just accelerate the degeneration. How about weight? How is weight a factor? Say you have some joints in your back or your knees. Knees are a big one for overweight people. Why do their knees hurt so much? And what does the weight do? If there's a lot of weight,
Makes it more heavier.
exactly. So you're increasing the load on a joint that's not lined up. It's going to wear down quickly. So a lot of times people come in and they say, well, my medical doctor told me I have to lose weight. They're not wrong. They're not wrong. If you have too much weight on your body and you're misaligned, you're wearing it down more quickly. So yes, getting the weight off certainly helps, but you also have to get motion back into those joints. Okay?
Also, just the NSAIDs, if you're taking it and your body's not used to it and it can harm your intestinal tract and create ulcers and all these not exciting side effects that you didn't have a problem with before, and you're introducing it to your body.
Exactly. You know the #1 cause of liver failure in the United States today? But what's the cause of it? What's the #1 cause of liver failure? Tylenol. Tylenol. Tylenol is a medicine that you take, but you can never take a medicine without a side effect. Did you ever notice that? Did you ever see the commercials? I sit there and I look at these commercials and I'm like, because they at the end of the commercials they read all of the cautions. Like
They're always way worse than you have.
Exactly. And I say,
You might die. Well, I'm only having a slight stomach ache now. I think I'm going to not take that and die.
Exactly. I mean, you gotta listen to these things. It blows my mind that people would actually listen to all these side effects and still take the drug. You know, and sometimes you have to. Sometimes you have no choice. Sometimes you need it to save your life. But like Shira said, it's a stomach ache. Maybe I should find out what's causing it rather than taking a drug to suppress the symptoms that could give me liver failure. Okay?
So now we are here at Dr. Suzi's office, and so we are treating the cause. And how are we treating the cause? What's the first thing you do when you come into this office after you've signed in and gotten your travel card? Get adjusted, exactly. And that is the first way. You have to treat the cause. This is what we're doing here. We're treating the cause, we're reversing the process, we're enhancing the repair, and we're stopping the progress.
Now, keep in mind, I say this a lot when you first come in. If you're coming to me for the first time if you're not right out of the womb and you're coming to me for the first time, you could be 10, you can be 20, 30, 40, 50, 60, 70, 80. I've seen people 90 for the first time. It would be like coming to me and never having brushed your teeth before and saying, you think you're going to find anything? What do you think? Absolutely. And do you think that all the things that we find at 20, 30, 40, 50, 60, 70, 80, 90 are going to be completely reversible? No, there's a lot of degeneration by the time we see you. So, you know, can we fix it? We don't fix anything. No doctor fixes anything. All we do is add motion back into the spine. Once there's motion, it can start a healing process. Is it going to go 100% back to normal? Chances are no. It's never going to go back to normal. But science is now proving after years of getting adjusted, you can increase the fluid in disc spaces. But it takes years. And again, it's not going to go all the way back to normal, but wouldn't you rather stop or slow the progression with an adjustment? Thank you. Rather than let it keep getting worse and worse and worse and worse. I can't tell you what breaks my heart more than people who come in and have family members who don't because they don't believe in it, or they're scared of the chiropractor, or it doesn't make sense. And they get sicker and sicker and sicker while their spouses get better and better and better. I think the saddest thing that ever happened to me was I was treating a woman for years and years, and she was, you know, flitting around, and her husband would never come, and he didn't believe in it, and he came once, and he's like, this isn't for me. And she comes in one day, and they were young, they were in their 60s, and she says, my husband passed away. And it was like this cascade of events that we saw him getting more and more unhealthy while she's maintaining her health over the years, and he dies. She was so devastated and heartbroken that he never came to get adjusted that she actually said to me a couple weeks later, she's like, I can't come here anymore. It's too upsetting to me. I have to find another chiropractor. She wouldn't give up on chiropractic, which I was happy about, but it was just so emotionally draining for her to come into an office where we always said, get your husband checked. You know, like, this happened, he's in the hospital. I'm like, get him checked, get him checked, get him checked. He wouldn't do it, and he died. You know, what are we risking by not telling people? Okay? I just went off on a little tangent.
The first thing we said is to treat the cause. So what's one of the causes that Dr. Suzi said before was the stress, the muscle stress, and we also have nutrition stress and what foods we're eating and how that's affecting our body. So one thing you can do is make sure you're eating healthy and not eating fried food or drinking alcohol, smoking. All these things can cause stress in your body, where you're having joint misalignment and getting arthritis. Like sun also, wear sunscreen, especially in the summer now, going to the beach.
How does that happen, by the way? How does something you eat cause stress in your body enough to cause a subluxation or joint misalignment? Does anybody understand that process? I mean, this is tricky. You see, when you have your spine, can you grab that spine for me for a second? When your brain is communicating with the body, and it travels from the brain down the spinal cord, out those spinal nerves to every part of the body, how does the body communicate with the brain? Along the same exact path, just in reverse. So say this is going to your stomach right here, and say you eat something that's like fried foods, and your stomach goes into distress. It's trying to produce too much acid and all that stuff to try to break it down. Now it's sending signals back to the brain, and it's sending them back rapidly because it's in trouble. Well, unfortunately, this nerve doesn't only go to your stomach, it also goes to the muscles surrounding the spine. So those muscles will go into spasm, and that causes the spine to go out of alignment. So an organ, any organ that's in trouble or striving or under stress, can cause, by simply overstimulating that nerve, problems and subluxations, because it's not just one nerve root to one organ. It shares its innervation with muscles as well. Yes, sweetheart. Yeah, that's stressful, right? You eat sweets and you cry? Okay, very good. So, keep
Also,
going.
these things that we were discussing, the fried food, smoking, alcohol, pesticides, all these things deplete key antioxidant nutrients like vitamin C and E and beta-carotene, and these are the things that are going to help you get better. And if you don't have them, you're already a step down, which is why it's so important to keep that level up, good nutrients. Okay, number 2 is reverse the process. So there's a great workshop here called the 9-Month Miracle, which is not about childbirth. You went to that one? Do you remember what it's about? You know what happens to the body every 9 months? It regenerates.
Every cell in your body regenerates in a 9-month period.
So, from the Journal of Bone and Joint Surgery, it says the nucleus of the disc retains its ability to regenerate within 6 months. Which means that you can, obviously at a certain point of degeneration it's hard and you can't, but you can reverse a lot of the process just by getting your joints back into alignment, because your body will regenerate. And yeah. Yeah, so if you catch it early enough, you can regenerate. And like I said, now they're proving that discs can regenerate over the course of years. And I've seen it happen. I've had patients that have been under care for 10 years, and I've seen their disc spaces widen. It's pretty cool that can happen. So, okay. Next is enhance the repair. Now you're on the mend. What are you going to do to help yourself get better faster? And it's not going to be medicine and pain meds, and it's going to be vitamin C and E, eating the food, instead of not just stopping to eat the foods that are bad, but also eating the foods that are good.
Absolutely.
So, glucosamine, I can't even see it, you say it.
Glucosamine, chondroitin, and sulfate. Has anybody ever heard of that? Okay, it's a supplement that's actually been proven to help with arthritis. So that's one supplement you can use. Vitamin C and E. There's been so many studies. Vitamin C is like a miracle cure. You know, that's something that when you're feeling sick or when you want to increase healing in your body, you're going to up your vitamin C. But at the same time, you have to decrease your sugar intake because they compete for the same binding sites in the body. So always lower your sugar and increase your vitamin C. Multivitamins, antioxidants, all really good to help the repair process.
Also, these are all great things in general. They're all helping you in a lot of different ways. So it's not like, oh, I don't have arthritis, I shouldn't be upping these things in my diet. You know, the first thing I think of when I hear antioxidants is it helps prevent cancer. Like
Absolutely.
everything that we're saying is universal. Okay, so now we want to stop the progression. We want to stop anything from getting more arthritic and our joints from breaking down more.
So what's the best way to do that? You want to add what? Motion. If you have motion, it can't wear down more. So you want motion when it's lined up correctly. And a lot of times, people are in too much pain to add motion, but one of the best ways to do it is with swimming.
And it's the summer, so it's the best time to do it too.
Because swimming takes the load off your joints. You're still getting that motion, but you're not pounding like you would if you were jogging or walking. So swimming is very good for you.
Also weights.
Yeah, isometrics, weights. The problem most people have with weights is that they go way too heavy. You don't have to do that. A light weight taking you through the full range of motion will do much better for you. And you can do more reps rather than try to do a heavy load, recruit other muscles, and injure yourself and throw everything out of alignment. Okay?
Stopping the progression, a huge part of making sure that we're not going further is to make sure that we are aligned. And one of the biggest things that throws out of alignment is bad posture, because that throws in the weight and the gravity, and it's all throwing us out of whack. You know, if you're standing like this, I just heard you say today again that it's like you're holding a bowling ball far away from your body. You know, it hurts. It's not comfortable. That's why I'm sitting straight. So reduce the weight you carry in front of your body. Hold things close to you.
Hold things very close to you. Never bend and twist at the same time. That's the worst motion for you. So if you need to lift a heavy load, keep it close to your body and use your knees to lift it up. No twisting or turning with it. Okay? Just get down low to the floor and use your legs more than your back.
No slouching in your chair. Yeah. We have these great lumbar supports if you need for your chairs that help you sit up straight. No sleeping on big fluffy pillows. Now, why might that be a problem? It sounds so comfortable. What could be wrong with sleeping on a big fluffy pillow?
Makes your body uneven. So
Yeah.
it's pressure on the neck.
Right.
When you're sleeping, you want your posture to be neutral. So if you're sleeping on your back, you want a little support behind your neck. Or if you're sleeping on your side, a little support right here. If it's too far over, you're going to strain. If it's too little, you're going to strain. And the same with back to front. You don't want to sleep with your head in this position. So at one pillow, a good supportive pillow, and that'll do the trick for you. And no stomach sleeping, because you're turning your head all night in order to breathe.
Also, we mentioned bend with your legs. Don't, also, reduce sitting. Get up and walk around a little bit. Stand up. It increases pressure on the last 3 lumbar discs.
By 10 times,
10
yeah.
times.
It's a lot of pressure. If you ever injure your lower back, try to avoid sitting. Either lay down flat or get up and walk around. But even if you have a job where you're sitting a lot or you're watching TV, every commercial, get up and just walk for a second. You know, if you're sitting at work all day, set a timer. Every 20 minutes, just get up and stretch for 30 seconds. It's all it takes. You'll be more productive, you'll feel better, and you're less likely to injure your joints.
And in general, it just feels better when you're up all. I'm saying, a lot of times we're here at the front desk and we get rid of the chairs and we're standing there, and it's easier to work. My brain is clearer. It's just much nicer to not be, sitting, especially because we are slouching a lot of the time.
Yeah, that posture that we get as we age, that's like this, we don't have to get that. That's why we use the wedge. At the end of the day, we reverse all the things that we do in front of us, because everything we do is in front of us. If we're doing our exercises, we're reversing that at the end of the day, we're not going to be like this when we age. But if we don't, gravity's going to take over because we're always doing things in front of us, and we're going to be like this. Does that make sense?
No.
Yes, it does. Okay, so
Ben Franklin said, while we may not be able to control all that happens to us, we can control what happens inside us. Sounds like we are what we eat, We can't control our environment as much as we would like to. We can control somewhat, Don't go outside in the sun for 5 hours without putting on sunscreen, or stay in the shade umbrella, big umbrella,
yeah,
But we can control what we do for our body inside. We can control what we eat, how we sleep, going to the chiropractor, getting the adjustment. All these things are in our control, not taking medication.
And most people think that once you have arthritis, there's nothing you can do for it. And this workshop is to try to show you not only is there something you can do for it, but the thing to do for it is to add motion, to get your adjustments, to learn the proper exercises, to maintain your bodies for a lot longer. And we're gonna go through all that. You gotta get to our stretching and strengthening workshops. You've gotta use your wedges, the things that we're teaching you to use, and your bodies will last you a lot longer. But another really important point is don't wait until you're in pain to get yourselves checked. If you haven't been checked already,
Friends and family.
yeah, for friends and family, we have Patient Appreciation Day coming up where we're checking spines at our expenses. We have ways of getting you in here that are affordable. Please take advantage of it, because what Shira's going to share with you next, and we have a copy of it for
My
you to take
favorite.
home, is a poem called The Ambulance Down in the Valley. And it basically talks about prevention being a lot easier than trying to cure something that's already happened.
Okay. Do you want to hand this out?
So just take one and pass it along, sweetie, okay?
Okay. The ambulance down in the valley. 'Twas a dangerous cliff, as they freely confessed, though to walk near its crest was so pleasant. But over its terrible edge there had slipped a duke and full many a peasant. So the people said something would have to be done, but their projects did not at all tally. Some said, but put a fence around the edge of the cliff, some an ambulance down in the valley. But the cry for the ambulance carried the day, for it spread through the neighboring city. A fence may be useful or not, it is true, but each heart became moved with pity for those who slipped over that dangerous cliff, and the dwellers on high and alley gave pounds and gave pence not to put up a fence, but an ambulance down in the valley. Then an old sage remarked, "It's a marvel to me that people give far more attention to repairing the results than to stopping the cause, when they'd much better aim at prevention. Let us stop at its source all this hurt," cried he. "Come neighbors and friends, let us rally. If the cliff we will fence, we might almost dispense with the ambulance down in the valley." By Joseph Malins.
1895. They knew back then that we're much better off with prevention. So, I beg of you guys, give these out. Tell your friends about it. Don't wait until it's so bad. One of the great things about this office is we're adjusting so many kids because they're not going to grow up with the same problems that we have. We're stopping it at the source before it becomes an issue later on in life. So, right? You love it? So thank you all very much for coming. Thank you to Shira. And I hope you all have a wonderful